Hello Shipmates, and welcome to the Audacious Podcast, generously powered by the Team Lewis Studios. This is the show where we'll dive deep into the extraordinary stories of people who normalise the extraordinary. I'm your host, Hugo Mitchell-Heggs, a Royal Navy submariner and 2 times ocean rower. And today I'm delighted to welcome our next guest, Sally Orange MBE, a former major in the British Army Medical Corps. She's a mental health campaigner, adventure athlete. She has run over 80 marathons on every single continent dressed as fruit. For those not watching, she is currently dressed as a piece of fruit, which we'll come on to in a bit. She is currently facing breast cancer with tremendous humour and resilience. And it is just such an honour to have you in the studio with us.
Oh,
Sally.
Thank you. Yeah, thank you very much for inviting me.
Firstly, can I start off with how are you today?
Yeah, I'm great, thank you. Doing really, really well. If you ask me that tomorrow or the next week, I have chemotherapy tomorrow, so it's probably, I know it's going to go downhill.
Right.
So at the moment, I'm sort of having 1 week out of 3, which is not so good, but making the breast of the other 2, you could say.
Love that. We're going to have a lot of these.
Yeah.
Aren't we? So I can't wait. And I just want to dive straight in. So the British Army.
Yes, yeah.
Where did your journey start? What attracted you to caring for people as a physiotherapist?
Yeah.
What attracted you to that whole world of being in the services, but also as a physiotherapist?
So I ended up doing 22 years in the Royal Army Medical Corps as a physiotherapist, and actually going back, it was at the age of 16 when I went ice skating for the day with my boyfriend at the time, and we were on the last skate round on the rink, and I fell over, he fell on top of me, and I broke my leg. I ended up having a month in a hospital, surgery, and it wasn't a particularly great time, made even worse by the fact that my boyfriend at the time went off with my best friend while I was in hospital.
That's horrendous.
But there's always a silver lining to
Right.
these things, and it, I was pretty physically rock bottom. I couldn't walk, but I learned what a physiotherapist did. And I really liked the interaction that I had with the physio, got to see that they were, helping me at a really difficult time. And I thought, that's what I want to do. I really want to go and do that as a career. So I was doing my A-levels at the time, and I was doing the right A-levels, but unfortunately, because I'd missed so much time off school with the break-in and the surgery, I got my results and I'd failed my A-levels. So I thought, right, that dream of being a physio is over. And I thought, no, it doesn't have to be. I'll just go and resit my A-levels. So another year of study, and I got my A-level results the second time. And unfortunately, I'd done even worse the second time than I had the first. So by this point, my A-level spelt "you dunce."
Love that.
So, which I think is pretty ingenious to work out.
If anything, it's genius, well crafted.
Yes. And so I thought, I now definitely can't do physio. So I'd got good enough grades. I'd got a C, D and an E, good enough grades to go to university. I went to do radiography thinking, well, that's similar to physio. And I remember being on a placement doing barium enemas, thinking, this is not how I want to spend the rest of, this is not physio. So I transferred to a degree that was at Leeds, where they actually did physiotherapy as well. And I thought, well, if I do that, then I can, each year I can apply for physio, and hopefully I'll get onto it that way. Unfortunately, I didn't get onto it that way, but I kept applying. So in the end, I'd applied for 6 years in a row, but been rejected every single time to be a physiotherapist. I finally, once I'd got my degree, got a place, and so another 3 years of study. So I first applied in 1991 and finally graduated in 2000. So 9 years, and it was after that, or actually while I was doing my second degree, that I learned about the University Officers Training Corps, and that was my first sort of introduction to the army. I'd got no background other than that, never been in cadets, no family members in the forces, and just saw that you could get paid while you're off, at university to, go off and do fun things and meet other people.
That's how they got me as well.
So and that's where, once I'd qualified, got the opportunity to then join the army. So it took a long time to get there.
The paths don't have to be linear, right? You can take and it doesn't change. If anything, you can pick things up along the way and learn more about yourself through those failures.
Definitely, right? It was definitely the scenic route rather than the direct route. And I did look really young when I was 18. So sort of 18, 21. If I'd have actually sort of graduated then, I'd look at it in that respect. And I also had 6 different summer holidays from university. So I went off and worked in America. I worked on kids camps and, did volunteering and all that. I got all those opportunities, which I wouldn't have had if I had just done the one degree.
Yes, so. It's not classroom stuff. It's the things that make the really important...
The life lessons.
Yeah, the bits all around it, the kind of surrounding, growth. It's just, exactly, life lessons. Love it. And then the army.
Yes.
Sandhurst.
Yep, so I joined the army as a reservist. Yep. So I only did a 2 weeks at Sandhurst. So, it was... but when I say that, there was still the expectations of somebody who had done the 44 weeks at Sandhurst. So, when I went into a full-time reserve role, which I did for 7 years... I was there with other officers and, I'd be on duty officer and you were expected to do this, that and the other. I was like, I've had 2 weeks, to be, taught these things yet. Because I was a professionally qualified officer going in as a physiotherapist. It was challenging.
It must have been a real kind of shock of, especially, anyone in the reservists, which I think is an incredible thing to do, by the way. To be able to flip that switch from a civilian life into, this is who you are now, whether it's at weekends or on full time. And some stories you told me earlier, but Afghanistan, busy time in your...
Yes, yeah. So I did a tour in 2011, and I was the first OC that was a reservist. Wow. But we saw some incredibly... really, really injured, guys and girls,
It must have been, that whole environment, you're watching and the teamwork that must have come with it and seeing courage in some of the most, brutal conditions.
Yeah. Because in the morning, we would go on to intensive care, and any of the guys that were sort of needing, that really sort of acute treatment before they were waiting to be flown back to Birmingham, we would go and see them in the morning, and then in the afternoon we'd have outpatients, and that could be guys who had been sent back from the FOBs, or it could be people from Camp Bastion who had the run-of-the-mill, chefs having burns,
everything,
the sprained ankles, those types of things, as well as, the ones that had come back. And we would keep them there for 3 weeks in the hope that we could fix them to be able to send them back out. But there were times where we would have to have that really difficult conversation and say to somebody, look, you're not fit enough to go back out there. And that was really tough because, people wanted to stay out there, and, having grown men, being really upset. But also what I did see is that quite often mental health would manifest itself physically. So it was almost as though it was a lot easier to say that there was an injured ankle, but sometimes you just needed to look into the eyes of the patient and you could see so much more going on, in their faces. And they were just seeing some, horrific things. And I think coming back, and having that sort of stepping back into a safe environment of sort of, Camp Bastion, and maybe, by having somebody female to speak to, I think there was real benefits to having male and female, because they'd perhaps been with guys all the time and not been able to say about, missing their, family or their, their partners. So I'd like to think that we offered an opportunity to be able to just get the human element of them out. And, and they did, some of them were just really broken. And it was almost easier to say, oh, my shoulder injury is what's stopping me, and why I've got to go. And, we had a close relationship with the mental health nurses, so we could sort of refer people to them as well, because, as I say, we had the opportunity to spend an hour with somebody, and you get to know someone, quite well. And
definitely,
especially, if they're not having to look at you, that's what, sometimes if you're treating a back and you're talking to someone and you're not eye to eye, then a lot more conversations can come out, because it's not quite as sort of direct almost, which is why I think now with treatments, sort of going out for a walk and walking alongside somebody, you can get so much more out of them than if you're sat face to face in that therapy type situation.
Like we are right now. No.
Yeah.
I mean, that makes so much sense, and that peer-to-peer support is so powerful, and definitely one of the things we're trying to encourage as much of now. Reaching out and spending time with people, and being able to. I mean, as you said, so much doesn't manifest itself through natural conversation. Some of it is literally how you observe people, behaviour, how they appear, the look behind their eyes.
Yeah, and I remember seeing in the cookhouse, sort of 18-year-olds that they just have this 1,000-mile stare that they just were vacant. They just, 18-year-olds should be seeing what they were seeing. But at the same time, for me, it was an environment which I felt I really thrived in, because I was with people. I was, you were sort of staying, sleeping, there was sort of 10 of you all in the same area. You didn't have a minute to yourself. So that for me was that real connection, that real sense of you're helping people, doing good for them. And it was essentially a really good time, but I knew that I was going to struggle when I left that environment.
So what did you do when you left that environment? How did Sally decompress after such a...
Yeah, so most people were going back to their family or partners, and I didn't have either of them. But I preempted that. So I had, before I went out, I'd applied to go and volunteer in India to build toilets.
Amazing. Whereabouts in India?
It was in a little village called Poonani. Which
I shouldn't be laughing at that, but
no, but I just remember
as someone who has two very young children and very familiar with Poonamese, I'm
the irony.
Yeah.
And it just, it was taking young people from the ages of 17 to 24 to do project work into an environment that we were living in, a tea plantation, in a house. I say a house, a bare shell of there wasn't sort of running water or anything in it. It was just concrete. It didn't have windows.
You kept busy straight away, and I think that's really important, isn't it? You can very easily think that decompression needs to be sitting around and resting in spas, but actually it's almost settling back into a different routine and having the mind kept busy, being with other people.
Yeah, it was that routine, being with other people. What was really strange that was in Afghanistan, you had the opportunity to get onto the internet. You had posts coming in, parcels coming in. And that was a situation where I'd been told you're going to Afghanistan, whereas I chose to go to India. Yet I didn't have any parcels. There was no internet, no phones. Phones were taken off, everybody. But they had been, in Afghanistan as well. So, but it was seen as a choice because, it was the same sort of remoteness, really. So it was quite strange.
Yeah. And where in all of this journey did running become more than just running, like a platform for hope for Sally?
I'd ran when I was younger. I remember when I was 8 years old, watching the very first London Marathon, thinking, wow, I'd love to do that. But it took me until I was 34 till I plucked up the courage to actually go and run a marathon. I just thought, I'm not good enough to run that
really
far.
long way, Sally.
It really is, and it still is now.
Yeah.
And I did a marathon. My very first one I did as a superhero. And I crossed that finish line, and for the first time ever, I felt like a superhero. And then I thought, never again. But then, this, type 2 fun, where at the time it isn't that great, but coming back to it, I thought, actually, I'll sign up again. And I'd already raised quite a lot of money, so I needed to do something different. I thought, well, my surname's Orange, so I'll run a marathon dressed as an orange. And I got the Guinness World Record for the fastest marathon dressed as a piece of fruit. And I then...
Your piece of fruit as well.
Exactly. My sort of strapline segment, you could say. I squashed that one in there, didn't I? And that was actually before Afghanistan. Then when I went out to Afghanistan, I did one dressed as a banana. Then I did the US Marine Corps one as an apple. And, they just kept... I'd find another marathon, I think, I found another piece of fruit. But what I found was when I told people what I was doing, that they smiled. And it was really nice to see someone smiling. And then they'd be like, why? Why are you running as an apple, orange, banana, watermelon, whatever? And I realised that there was an opportunity to be able to change the conversation and break the stigma associated with poor mental health because of wearing a costume. And then people would say, I've had a problem, I know someone who's had a problem, and it just really subtly opened up that conversation. I really struggled with my mental health, not necessarily in Afghanistan, but to be honest, I hid it for a long time, for 20 years. And, actually looking back, not passing my exams, that was exam stress back in those days. But I was putting a lot of pressure on myself that I had to get the grades to get into physio. And if I didn't, I failed. And, that 6 years of failure sort of had, or not getting those grades had an impact on me. And so my mental health really deteriorated. And I just didn't want anyone else to ever get to the point that I'd got to. I got to the point where I couldn't see a reason to live. I couldn't, there was no smell, there was no taste, there was no colour to the world. And I just felt that the world would be better off if I wasn't in it. And I didn't leave the house for 2 months. I didn't speak on the phone for 2 years. And I just went through so many years just in tears. And, on the outside, I'd be smiling and, she's always happy. But inside, I was a very, very different person. And as I say, I just didn't want anyone else to get to that point. And I ended up being medically discharged from the army because of the depression and anxiety. And I don't feel that it had to be that way. I think, actually, if you can help somebody and they can work around it, they can actually become particularly in my profession, they become better physios because of it, because you've got this understanding. I'd gone into physio because I'd broken my leg, and that gave me an understanding what it's like for somebody to be physically broken. So if you've then got somebody who has mentally struggled, they can pick up on it. On my patients, I could see the signs, and not even necessarily patients, but colleagues. And when you've been somewhere,
it's one of the most common things in the world, isn't it? Is that one in 3 people will suffer from a mental health related issue.
Yeah.
So it doesn't. I mean, it's amazing. I mean, what's amazing is that you brought so much colour to the theme of it. And I mean, I've loved following you these last few years and how you tell the story.
Right.
Yeah. I'm not allowed to swear, but I really want to swear. That's very good. No, it's incredible. In fact, this is probably a nice time for me to stick some fruit on, isn't it? So this led to you running over 87 marathons.
That's right, yes.
On every continent in the world,
yes.
Dressed as
different
fruit?
pieces of fruit.
Yeah.
There's been a couple of, mainly fruit, after about 50 marathons, somebody said to me, "You're completely nuts." And I thought, what a great idea. So I got a nut costume and I made a sign that said, "Nuts about mental health. Together we can crack it," and got the Guinness World Record for the fastest marathon just as a nut.
How many world records have you now got under your...
6 Guinness World Record certificates, but there are a couple of others that are world records but haven't been counted by Guinness. So I've done them as a box of cereal. I had a cereal box that said your mental health is as important as your breakfast cereal. But predominantly fruit. And then I did that on every continent. And I know that I'm the only person because the Antarctica Marathon is so small, and there's been no one who's done it.
A few penguins, and then...
Actually, we didn't see any wildlife at all.
Oh, my goodness.
No wildlife at all.
Just a piece of fruit running around the South Pole.
I got my nice pear out when I was in Antarctica.
Oh, my goodness.
I did it dressed as a pear.
Brilliant.
So I then saw an opportunity to do 7 marathons on 7 continents in 7 consecutive days. And I thought, right, I know it's, there's a high rate of potential failure with that. And so I decided to give myself that little buffer so that I wasn't too hard on myself if I didn't achieve it. So I decided to do it as a vegetable. I thought I'm going to try and do every continent as a vegetable. And Antarctica was the hardest, the most expensive to get to, and that was the first marathon. So I thought if that's all I manage to achieve, it will still set me on the goal of this next one. So if you're going to go to Antarctica and you're going to be frozen and be a vegetable, what vegetable would you be?
Well, come on. Frozen peas?
Yeah, I went as a pod of peas.
My daughter's favourite vegetable. Well done. Love that.
And when, on the first day, nobody knew each other. It was the same plane that took you all around the world. And so nobody knew each other. Everybody'd got their eyes covered up. They'd got their goggles on, their buffs. So you couldn't tell who anyone was.
And there's this pod of peas running around.
Exactly.
Yeah, love that.
And it started that conversation. I got onto the plane dressed as a pod of peas. And so it got people talking, and it just lightened the conversation and just, made it easier. So, that's how that started.
I love that. And out of those 8, do you remember each one? Are there highlights that...
I could not tell you the time of any of them apart from the Guinness World Records, but I could tell you exactly what I was wearing for every single one.
That.
Yeah, so it's almost a bit of a change of narrative in that, quite often with marathons or races, I don't call them races, I call them events, because again, I've got that, that failure affects me quite hard. And so rather than, if people say, what time are you going for? There's a lot of people who want to break that 4-hour mark or whatever. And I know that if I do that and I got 4:02, then I'd feel a failure. So rather than going for a time, I go for the time of my life. And that way I'm in control of if I have a good time.
That's so powerful.
I can't control other people. I can't control the weather. But I can control if I put a smile on my face, or, if I see the crowds and, little children sort of, give me a high five, that kind of thing. And that's what I go for. If I can help somebody else along the way, if they're struggling, and it doesn't matter if I have to walk with someone because I've not got that, you have to get this, get this time. So they still hurt. And sometimes it's more of a grimace rather than a smile. But I'll tell myself, you will smile. Because you never know the impact that you're having on someone else. And if, a young person sees a smiling, pineapple or, running or walking by, what seed does that sow in their mind that, if a pineapple can do it, maybe I can do it.
Yeah.
So it's just changing the narrative, really.
I love that. Especially have you spoken so openly about your own struggles with depression and anxiety and, and actually linking it back to that, what allowed you to start that conversation? What helped you?
To be honest, I'd got to crisis point.
Yeah.
I had got to the point where I wasn't functioning. I wasn't eating, wasn't drinking, wasn't speaking. I would just spend 20 hours of every day just crying. And the crisis team were called in. I was already on medication, but the psychiatrist, I wasn't quite on the right medication. So, it was accepting help, really. I'd fought for a long time, but it just got to the point where I just couldn't cope.
Yeah.
And I think it was a very gradual, through the psychiatrist, through the crisis team, through the change of medication, and then, sort of counselling, talking. And again, I liken that to, as a physio, if you've got a broken leg, you'd get crutches, to help you. And then you'd go from crutches to maybe one crutch, to a stick, to limping, to then finally, walking slowly, and then running. And it's the same really for me, that the medication was the crutch. It didn't mean that I always needed medication. The talking therapies might need that, they're like the exercises that come with, the physio. And, there'd be a few steps forward, a few steps back. And, accepting that, I do still take medication, and I do still see a therapist. So I essentially walk with a stick, but do my exercises at the same time. And there's, the same, if somebody goes to a gym, that if they don't do their exercises, they deteriorate. Yeah. So that's more of a maintenance. And we all get into bad habits. So if you don't check in with someone else, then we can get back into bad habits. But you're just reminded at times. So.
And that's how you maintain that side of it now. So that in terms of today, 87 marathons later, Sally today with us here in the studio, what are the things you do for yourself to keep your
So when I say exercise, I'd say movement.
Yeah.
Movement is medicine. That's what whether that be a walk, whether it be a run, a swim, a cycle. I've done, quite a few swimming challenges, quite a few cycling, big cycling challenges, but anything that gets you outdoors. So you connect with nature. If you can do it with someone else, sometimes that's great. Sometimes it's good to do it on your own. Sometimes I'll use a certain run or, and go, right, I'm going to think about this problem, this topic, and sort of package it into a box. That is the dedicated time for that. I also now have almost like a physical mental health first aid kit, which is a box, just like a first aid box. But in that box are little things, like there's a stone, which is smooth, but, just touching it and feeling it. There's certain perfumes in there, that there's certain smells.
The 5 senses, I love that,
photographs, so, the loved ones or memories of certain times. And there's taste as well. So certain sweets, a polo mint just gives you that freshness again.
Not the Rat Pack boiled sweets that they know.
The same effect. But so it is something that I can physically go and get, and listening to either meditation or those types of things. So it is an actual physical mental health first aid kit. Which, do you know what? This has just come to me. Why don't we have that in a workplace? To just say, someone's struggling, just go and feel a smooth stone, or because then it's almost a detraction, from your thoughts. And sometimes,
it's one of the many tools that could be, there's some amazing tools that are that are great for maintaining mental fitness, like day to day. Yeah, no, I love that. And mental, I love breathing exercises and meditation, and your movement is medicine thing is the key. I notice my own mental health deteriorate when I'm sat doing nothing for long periods of time, and it can very quickly dip if you don't keep on top of it. So
I often say to people, and you'll get this from your background, that you wouldn't learn to swim in a storm.
No.
So why, with our mental health, do we wait until we get to crisis point before we learn the tools that are going to help us? Whereas if you learn those tools when you're well, they're much easier to put into place when you're not well. If you're trying to learn those skills when you're not well, it just didn't work. Yeah. It doesn't go in because, you're just on sort of sensory overload. And, as I say, I just cried the whole time. Whereas, if you're taught these skills or learnt these skills, that when you start to feel yourself deteriorate, that's what you need to do.
Yeah.
That'll make you feel better, and you don't have to go, quite that low. So, yeah.
Amazing. And Sally, so I also wanted to ask you about breast cancer and your journey at the moment, how it might have, how it's affected your perspective on recovery and your vulnerability and overall resilience. I mean, the fact that you're dressed like this, and for those listening, we've got Sally's now dressed in a full boob costume that says breast cancer now with Sally on it. Can you tell me a little bit more about what you're wearing?
Yeah, so in February of this year, I was actually training to go and climb Mount Aconcagua in Argentina. And I was training in Tenerife because they've got lots of hills up there. And I don't normally train for anything. And I'd only given myself 3 weeks training. So it's not like I'd been, training's cheating is my sort of motto. But I decided to take a day off, and I was buying a new bikini. I was in the changing room and I suddenly noticed just a bit of a shadow. I just thought it was the light in a different way. And then I kind of just felt, because it was quite high up, and I just felt, and I thought, oh, there's a bit of a lump there. And I thought, no, it's just a rib. It's where your rib goes down. I checked on the other side and thought, maybe it's not a rib. But I just kind of put it to the back of my mind because I was going to Aconcagua very shortly. And so I didn't do anything about it to begin with. And knew all the time, obviously, that it was there. But then when I got back, I actually broke my wrist on the way down from Aconcagua, and I needed to go to the doctor about a few things. So I saw the doctor and I said, oh, I've broken my wrist. I've got pain in my side here, but also I've got this lump. And she said, oh, we'll refer you. So I was referred to the breast unit, went on my own, had a mammogram, couple of ultrasounds. They were like, oh, we'll just do a couple of biopsies. And I'm sort of looking at my medical background, looking at the ultrasound, going, can you see anything? And they did say, oh, we can see a few, changes. Another mammogram, then went in with the consultant, and she said, you've got breast cancer, just like that.
Just like that.
Yeah. And I literally said, I haven't got time for breast cancer. I said, I've got the London Marathon, and then I'm doing the Everest Marathon, and then I'm walking the length of Corsica. And they said, you're probably not going to be doing all of those. And I kind of asked what the different timescales were. And I was able to do the London Marathon, and I asked if I
remember coming to watch you, actually. I cheered you, yeah. That was my little one, yeah.
As the boob. I was due to be doing it as a lettuce because I was on this vegetable journey around all the continents, and I had a sign that said, let us talk about mental health. But then it seemed a real sort of, great time I knew I'd got this boob costume under my bed, because who doesn't have a boob costume under their bed? And I thought, yeah, I'll wear this, and as I say, make the best of the situation.
Yeah.
And
there's another one. Can we edit that one out? No.
breast foot forward then, in that case.
Love that.
And so did the London Marathon, and then I had a really difficult time because with the Everest Marathon, I was going there to make a documentary. I'd done it the year before, dressed as the lemon, actually. And while I was there, that was to be able to take the mental health message to the top of the world. Having already taken it around the world with the World Marathon Challenge, I wanted to take it to the top. And while I was doing that marathon, my guide ended up asking me, what's the lemon all about? And I told him about the mental health and the challenges and how I manage it. And he said that he had problems. And I asked how he managed it. And he said, through alcohol. And I said, okay. And then he came and asked me for help. He said, I need your charity's help. And I said, I don't have a charity. I raise money for charity. But I said, let's get back to Kathmandu and see what charities there are that can help you in Nepal. And over the next year, we kept in contact. He went to his GP and was diagnosed with PTSD and got help with that. And he said to me, you've helped me. He said, maybe I could help others if I was to talk about it as well. And so for me, the most significant part of that Everest Marathon wasn't climbing up to base camp and running the marathon. It was the fact that a male felt that they could open up to me, and a Nepali male who have a very different background and community. So that's why I wanted to go back to Everest the next year, to go back and meet him and make a documentary about the benefit of the outdoors on mental health and how, him tell his story. And so there was this time where I had 10 days between being told and then sort of finding out what stage it was at, that whether or not I could go. And I spoke to the consultant when they knew and said, could I delay my surgery, because I'd already got the film crew that were, sort of going out there. And luckily I was then told, yes, it wouldn't be detrimental if I was to leave it 3 weeks before I had the surgery. And so I decided I would get the boob outfit. I would trek to Everest Base Camp dressed in this. It got, my backpack on the back. And I didn't know if it was a bit insensitive culturally to begin with, but I had some beautiful moments where, this one particularly, this Nepali woman was, she was looking at it underneath and looking, what is it? And then I asked if she wanted to put it on, and she's laughing, and she put it on, and it was just, we didn't speak the same language, we didn't know, any words, but we'd got this massive laughter, connecting through this costume. And, people who I saw, it touched a lot of people. Either they'd had it or they knew somebody who'd had it. And, I'd get everybody to check. And I would even check some of the males, because breast cancer doesn't just affect women.
I didn't realise that until I was reading up on it as well. So October is breast cancer awareness month.
Yeah.
So, and it is one of the most common cancers particularly in women, but men as well.
Yeah. So one man a day is diagnosed, but so many more. And in fact, since I've been so open about my story and my diagnosis, I've had 5 women who've got in contact with me and said, because of you being so open and you being fit, technically, I decided to check myself and I found a lump, and I'm now being treated for breast cancer.
And the earlier anything can be diagnosed, obviously, the better.
That's the thing, that obviously that's not a good thing that they've been diagnosed, but if it's been caught early, then yes, that's the thing that can help people and educate people. And I've now noticed in changing rooms when I've been since, they have got the sort of the look, feel, and showing you how to check your breasts. And on the first of each month, if people can put a reminder in their phone to sort of do it, so they get to know what's normal for them. With it being one of the most common, the great thing is there has been so much research, and initially it was thought that I would just have to have surgery and radiotherapy, but unfortunately for me it had actually spread to my lymph nodes as well, so that's what makes it stage 3, which then meant I needed to have chemotherapy as well. So up until that point I'd sort of thought, well, a bit of surgery and a few bits of radiotherapy, but now it has had a bigger impact, 6 months of chemotherapy, which is not pleasant. As you can see, I've got a new hairstyle, which amazing. doesn't take long to get ready in the morning. But it does have an impact on your confidence. And I think it makes you look like a cancer patient. I don't feel unwell. I didn't with any of the symptoms. I didn't have any symptoms. Yeah. But the chemotherapy does have an impact on your body, and it's also the longer term impact that it has. So after the chemotherapy, I'll have to have 15 sessions of radiotherapy, and then I'll have to take drugs for another 10 years. And that's all to reduce my chances of the cancer coming back again. Yeah. So, and it's different for everybody. So it depends on your age, it depends on where the cancer is, the type of cancer it is, the size of cancer, where it's sort of spread to, and then the oncologist sort of looks at all of that and whether or not chemotherapy, radiotherapy, hormone treatments, what can sort of help with it. And obviously some women have to have their breasts removed. I was also tested for the BRCA2 gene, which is a sort of a genetic mutation, which fortunately for me I didn't have, but we know of women who have that, and so then have to have double mastectomies, and that, my breasts they're not the same anymore. We do say that they're more like sisters rather than twins, but they're definitely very different. They've got very different personalities now. For me, that hasn't affected me too much. But I honestly think that if you were to compare the mental health challenges that I've had with the cancer is nothing in comparison to the mental health challenges. The support that I've been offered has been incredible with cancer, yet on most, as I say, sort of 2 out of 3 weeks, I feel okay. It's only the week, which is pretty grim after the chemotherapy, but it was constant with mental health. It was just, and there wasn't the offer of support. There wasn't the reaching out, or, people understand or not knowing what to say.
The hardest invisible.
Yeah.
But regardless, I think your platform and how you share and how you're so vulnerable and how you bring so much energy and optimism.
I sit in my chemo session with this on.
Yeah, exactly.
Other people in the chemo, and even the nurses, you see them smile, and I'm actually running to all of my treatment sessions. So whether that be my blood tests, I've got a PICC line in that has to be flushed every week. So I just run there and run back. So again, that movement is medicine.
And it's making you feel better, feel good in your
I had a lovely situation where I went into the waiting room in my running kit, and an older gentleman in the chemo suite, he said, "Have you just cycled here?" I said, No, I've ran. What? You've ran to chemotherapy? I said, yes. And he said, well, maybe I could park my car a little bit further away. And I said, that's all it takes. And so for me, the fact that one person, just from me saying that, he said, you've inspired me just to park that little bit further away, because I explained that in my mind, the blood is flowing and pumping around, and so the chemotherapy will get in, sort of quicker. So, there's the small little wins. And then I go to the park run, after I have my chemo on a Wednesday, I have park run on a Saturday. And other people have said, gosh, if you're doing that with chemotherapy, what excuse have I got not to do it? So again, it's one of them, you never know when you're inspiring other people just to make...
You've inspired me. You're giving me the...
Little,
you're giving me the kick up the arse.
Yeah, you don't have to go quick, take the little ones in the buggy, or, or just, go out for a walk. So, that's...
Well done, Sally.
That's what's pleasing.
So obviously that's a big part of what's going on in your life at the moment, but I'd love to ask you about what your next Sally Orange Audacious challenge is looking like. The documentary is a big part of it.
The documentary that was going out to Everest to film, as I said, I was able to go, which was great. And it's a documentary called When Life Gives You Lemons, Everyone's Everest, because we all have challenges, we all have mountains to climb, they're not always visible. And it's showing the power of the outdoors in being able to do that. So, the breathing, the movement, the colours, the sensation of wind on your face, or, all of those things. And although it's sort of using my story to meet other people who have summited Everest, so Sir Chris Bonington features, and he tells about his own struggles and how actually going out for a walk in the Lake District is what really grounds him. I've got some, fantastic stories in there. We recognise that poetry can help with mental health. So we put out a competition for a poetry to get somebody to write a poem that would connect nature to the outdoors. And the winner has had Joanna Lumley narrate the poem for the documentary. We've got, professional, professors in. So there was another lady who was actually doing the Everest Marathon, who had also got breast cancer, and she happened to be a professor in breast cancer. For 17 years she'd studied it and then got it herself, had a double mastectomy, and happened to be doing it the same year that I was. Another friend, she'd rowed the Atlantic, and she got home and she found out that she'd done it with bowel cancer, and she connected with me and said, you're always doing great things. I want to be able to do something for my 3 years clear of bowel cancer. And I said, well, I'm going off to do the Everest Marathon. And she said, well, can I come and do it with you?
Amazing. This is Felicity?
It is, yeah.
Who's going to be on the show at some point?
So we did
Looking forward to having Felicity with us.
We did that together. And then I found out 3 weeks before we were setting off that I didn't know if I was going to be able to go because I had got breast cancer. But she said, I inspired her to do the marathon, but then she's inspired me with her chemotherapy and known that she's got through it. She came to the first chemotherapy with me, and it's kind of tables turn. You never know how that will happen.
It's amazing how these moments of adversity there can be good that can come from it.
Oh, definitely.
And connection and people and the amazing power.
I've given myself a challenge to find 100 positives of living with cancer.
Wow.
And I know that sounds strange, but there have been so many amazing things that have happened. And I really want to show people that it doesn't have to be doom and gloom. The fact that I can go out and go for a run, yes, I've got a PICC line in, but I can still do things and get outside, and hopefully other people can see from that it's not always a life sentence, and let's get the most out of life. I've got 3 weeks when I don't feel, the 1 week when I don't feel good, but I've got 2 weeks when I do feel okay. So make the best of those 2 weeks, and you become grateful, for those when you feel so rubbish. What it's like to then feel good again. So I'm just really sort of grateful for those.
Can you think of a positive that's come out of failure in the past?
Well, when I think back to that failure of my A-levels and not being able to get into university for those 6 years, and that was heartache every year when I didn't get in. But funnily enough, 30 years after I was first applied for university, the university that turned me down for 6 years in a row, where I did actually go and study, I got an email 30 years, pretty much to the month later, saying, we'd like to offer you an honorary doctorate for your services to physiotherapy and mental health. So to find myself as Dr Orange.
MBE. Lovely.
MBE. Forget Dr Pepper. This is Dr Orange.
That's incredible.
Just shows again that journey doesn't have to be direct. That scenic route that you can get from, going through different adversity is.
I think that's amazing, especially for people with going through their own journeys, or with young children, where things might seem like it's not as straightforward. It's not a straight line. Actually, it doesn't have to be.
And that's the beauty of it. In actual fact, now, I never thought it at the time, but it has made me more understanding. Anyone who's been through, physical injury, mental health challenges, cancer, I seem to have ticked all of those boxes. But it does make you more empathetic and compassionate to other people, and I think this world needs so much more kindness and empathy and compassion. So
the world needs more Sally Oranges. Definitely.
Oh, I don't know about that.
Yeah, big old fruit salad of
juice. Do it.
Yeah. We have to bleep that one out as well. Yeah.
I do say, Nike might say just do it. Sally Orange says juice do it.
Juice do it. Very
because
good.
things are fearful, and we don't want to step out into, things that are difficult. But, for young people, they want to fit in and, all of this. But actually, when you get outside into life, you have to be that little bit different to get noticed. And, dressing as a boob or as a slice of fruit is what's got me to different places. So, it's nice being able to tell young people those kind of things.
They don't have to fit in with they have to benchmark themselves off their peers all the time, that there's so much more out there, and they can
your grades don't define you, and they don't it doesn't equate to the determination or the effort put in, because I put in loads of effort. I just am not very good at exams because the nerves get the better of me. But when it comes to actually being able to talk to people and hopefully being able to motivate people, certainly as a physiotherapist, I had to get inside the mind of somebody to get the buy-in for them to do the exercises, because you can give them the exercises, but if they don't do them, they're not gonna get better. And so for me, it's the connection that's more important than the academic side of things. And I think that's what young people need to take away these days.
Definitely. In fact, let's leave it on that. Look, what is the key thing from this chat, Sally, that you would like our audience to take away with them today?
I think I'd probably go back to the not waiting to learn to swim in the storm. So when you're well, looking at, the tools, the techniques that we need to learn, that when we are well, that should we need them in an emergency, we know what to do. You'd do that with CPR, for somebody if they were to have a heart attack. So why don't we do it with our mental health? It would be so much easier. Just teaching people how to breathe and, sort of calm themselves would help so many people, that if it was taught in school, just lower that anxiety. Because, I think that's what I'd say.
Amazing. And if anyone wants to get hold of you, you've got a website, Sally Orange.
SallyOrange.com.
Beautiful, good guess.
And LinkedIn, Sally Orange, Instagram, Sally Orange MBE. Yes, Sally Orange.
Amazing.
Orange by name, orange by nature.
It was so lovely having you, Sally.
It's been amazing. Really nice to chat.
One of the traditions that we have in the Navy is challenge coins. These are usually a small medallion or sort of amulet style thing for every unit, ship, base, and as a small token of our thanks for joining us, I'd like to give you our Audacious podcast.
Thank you so much. Amazing, thank you.
Thank you so much for listening to the Audacious Podcast today with Sally Orange MBE, and generously powered by the Team Lewis Studios. See you next time.